I've made several videos on why Dutasteride is better than Finasteride, all of which you can find links to in the description. The most popular study that I and others refer to would be the 2006 Olson and colleagues clinical trial paper on Dutasteride for androgenetic alopecia, titled, quote, "The Importance of Dual 5A Reductase Inhibition in the Treatment of Male Pattern Hair Loss. Results of a Randomized, Placebo-Controlled Study of Dutasteride versus Finasteride," unquote. The study found that Dutasteride significantly increased hair counts in men with androgenetic alopecia in a dose-dependent manner, with the 2.5 mg dose showing the greatest increase. Compared to Finasteride, Dutasteride 2.5 mg was superior at 12 and 24 weeks. Expert panel assessments confirmed these results, showing significantly greater improvements in hair growth for Dutasteride compared to Finasteride and placebo. Serum DHT levels decreased significantly with Dutasteride, especially at the 0.5 mg and 2.5 mg doses, showing reductions of 92% and 96.4% respectively. Scalp DHT levels were also significantly reduced in a dose-dependent manner, with the highest dose of Dutasteride causing a 79% reduction. This reduction in DHT levels correlated positively with increased hair counts. The study found a significant inverse correlation between serum DHT levels and target area hair counts, meaning that lower DHT levels were associated with higher hair counts. Scalp testosterone levels increased with Dutasteride treatment, reflecting the inhibition of DHT production. The 0.5 mg and 2.5 mg doses of Dutasteride were particularly effective in suppressing scalp DHT, leading to notable increases in hair count. The correlation between reduced scalp DHT and increased hair counts underscores the importance of DHT in the pathogenesis of androgenetic alopecia. When it comes to side effects, the 2006 Olson et al. Study found no significant differences in the overall incidence of adverse events among the treatment groups, including placebo. However, some subjects experienced decreased libido. Specifically, decreased libido was reported as follows. Placebo, 2 subjects. Dutasteride 0.05 mg, 2 subjects. Dutasteride 0.1 mg, 2 subjects. Dutasteride 0.5 mg, 1 subject. Dutasteride 2.5 mg, 9 subjects. Finasteride 5 mg, 3 subjects. In the 2.5 mg Dutasteride group, out of the 9 subjects who experienced decreased libido, 4 saw a resolution of symptoms while still on therapy. 2 resolved symptoms within weeks after stopping therapy. 1 subject continued to experience decreased libido but deemed it unrelated to the study drug, and 2 were lost to follow-up after switching to Finasteride. None of these subjects discontinued therapy due to decreased libido. This indicates that while higher doses of Dutasteride are associated with a higher incidence of libido loss, the side effect was generally mild to moderate and often resolved over time. And this is very reassuring, as there are several other studies that come to a similar conclusion. For instance, the study, quote, "Comparison of Clinical Trials with Finasteride and Dutasteride," unquote, by J. Curtis Nickel, evaluates the pharmacologic effects, safety, and efficacy of these 2,5-alpha reductase inhibitors in treating benign prostatic hyperplasia. Finasteride selectively inhibits the type 2 isoenzyme, whereas Dutasteride inhibits both type 1 and type 2. Clinical trials have shown that Dutasteride reduces serum DHT levels significantly more than Finasteride, with a mean reduction of 94.7% compared to Finasteride's 70.8%. In a 12-month comparative trial, 813 patients received Dutasteride and 817 received Finasteride, with 719 and 735 patients completing the study respectively. Both drugs showed similar efficacy in reducing prostate volume and improving urinary flow and symptoms. The most common adverse events were sexual in nature. Decreased libido was reported in 5% of Dutasteride patients and 6% of Finasteride patients, while impotence was reported in 7% of Dutasteride patients and 8% of Finasteride patients. Generally, Dutasteride appeared to have slightly fewer drug-related sexual adverse events compared to Finasteride. Although dutasteride users may have a slightly lower side effect rate than finasteride users, it should be noted that due to dutastride's half-life of approximately 5 weeks compared to finasteride's half-life of 6 to 8 hours, it may take longer for side effects to subside after discontinuation. This means side effects may persist for some weeks after stopping the medication, but they are not permanent and usually go away with continued use. In the study by Olson et al., users of 2.5 mg of dutasteride may experience a higher frequency of side effects compared to users of finasteride and 0.5 mg of dutasteride. Despite dutasteride being more potent than finasteride in lowering DHT, it might have fewer side effects due to its pharmacological profile and specific action mechanisms. I would say that one possible theory is dutasteride's dual inhibition of both type 1 and type 2,5 alpha reductase enzymes allows for a more balanced reduction in DHT levels across various tissues. This dual inhibition may mitigate the localized high concentrations of DHT in tissues where finasteride, which selectively inhibits only type 2,5 alpha reductase, might cause an imbalance. Additionally, dutastride's higher affinity and prolonged binding to the 5-alpha reductase enzymes could lead to more stable and sustained DHT suppression, reducing the hormonal fluctuations that can contribute to side effects. Another aspect to consider is the difference in their molecular structures and how they interact with other receptors and enzymes in the body. Dutasteride might have a more selective action, reducing unintended interactions that can lead to side effects. Finally, the metabolism and clearance rates of dutasteride and finasteride differ as seen in the half-life differences. These are just some soft theory explanations, so don't take this as complete fact. But I digress. We do have another study which I have talked about in depth in other videos, which is a long-term dutasteride study. The study titled, quote, Long-Term Efficacy and Safety of Dutasteride 0.5 mg in Korean Men with Androgenetic Alopecia, 5-year data demonstrating clinical improvement with sustained efficacy, unquote, by Sungmin Choi and colleagues evaluated the long-term efficacy and safety of dutasteride 0.5 mg in 99 Korean men aged 18 years and older with androgenetic alopecia. The participants were treated with dutasteride for at least 5 years, and their hair loss was assessed using the basic and specific classification system, a modified version of the Hamilton-Norwood scale used in South Korea, which shows the various combination patterns of androgenetic alopecia. The specific classification includes the specific V for vertex and specific F for frontal types. This study also used the Investigator Global Assessment 7-point scale. The results showed that 89.9% of patients experienced clinical improvement and 93.9% showed prevention of hair loss progression. Improvement was most notable in patients with the specific V for vertex type of hair loss, with 82.2% showing clinical improvement. The study concluded that dutasteride 0.5 mg is highly effective in improving hair growth and preventing the progression of androgenetic alopecia over a long-term period of at least 5 years, with sustained clinical efficacy and a favorable safety profile. So with this kind of information, it's no wonder why people may want to switch from finasteride to dutasteride, or at the very least implement dutasteride in some way in their hair loss regimen. Now, this isn't to say that finasteride doesn't work or isn't effective. We do have studies that show its long-term success too, such as the 10-year Japanese study and 10-year Italian study. However, some people do lose ground and have very aggressive hair loss at young ages. Dutasteride use in some way, shape, or form may be enough to help those individuals. In the next sections or videos, depending on how I cut things up, we will explore the various implementations of dutasteride as well as transitions. I'll also include what I did. Remember, talk to your doctor and do not self-medicate.